say, if you have a 2-year-old and I said to you, they be or screaming or shouting, what can they be? I say, I am not the same with face, is here, Daniel Sim. I know you're normal, but some kind of behavior in a 7 or 8-year-old should raise questions, right? So your age appropriate. In the area, Obani do best 3, still Kasan and Shedan Baba. With me, Canada Mama, but no. Want me can't just come in and ask me pinch you. These are things we have to think about and be worried about. At the show, we do 5, still to these are things that we have to think about and be worried about. We have age appropriate stages of development, right? And now, Obia we do best 4. Who say sebio or display their sexual behavior kaka. And no one should to normal yet. It's too appropriate for the age. In TTC, still be some say assembly siana or be introducing our baby for. These are questions that we ask. So in terms of age appropriate, it is either what is there is not there, or what shouldn't be there is still there.
Yamwa kwaba eba yenkomo eso ye the mental health nkomo efi Premier Care Hospital ewo Kasoa Tuba ewo Greater Accra ene de ebremu ene ye ne Doctor Lorna Lartey ena edi nkomo wo bie mani wo niam ahodo bi ho enam feeling nkomo no is fi say sabre kono me read keke about mental health me de me ho ba jim na mahwede betimi aye edi abo me nipadua eti Ubetu a post so a woso ma obi na ebe sure dia ma. Doc, ye be call in the first episode no. What church mental health na ni so a emede. But uka bibi te say abofra ontimi nsua de a as a parent, ma menye selfish kakra with ye nkomo young asana ma ba foforo de so. Ubeka chem say mental faculty na yes but I take am and I may yes am from kwan.
There you are.
About time you're very worried about my performance for school. Sometimes, your school fees ne pa utia. To me ko 9,000. Na obey beba. A class of 35. You can't free to wa. Udi 3 and a 4. At ho. Enyasa akole onsia de. Ase enko about time be.
Well, there were more reasons be bra as the assembly to me see. One, send your musiade, and also so. Okay, in Colabi be a musiade, but at a musiade, but sometimes a musiade. But you hear say a lot of times it's more about your friendly change in performance.
Okay.
Now, yeah, dear. And I understand now or then film see yourself wabafom. A DNA assistant or abroad. A DNA assistant. A lot of times I know you are the first telling sign say I said BB koso.
Okay.
Into say my ni waso. Sometimes in Kolan so in Dana assistant. Ebia Omoda papa basisia in Dana and Shedan papa. They be as a sorry what to say omuye BB with them. And now, omo be brave. Change first. You see, if you don't go and wake him or her up, they don't wake up. Oko school bar, akoda. Obenya say ombeji, odidia, or cobium. That's not how they used to be. Well, those are some of the signs. Edidium so ate. And yeah, it's not just physical. Yare and Emma appetite no bafom.
Okay.
I dream we are so to me affect edidium. Inti ebia woman ice cream cake or this here on pay. Those are some of the issues that we have to worry about. A lot of the time, the instance that you gave say ebia akolano we den additional nkoye. I say we also have to look again at how the child is learning, if the learning is effective, and share stumbling blocks more kakra. But these examples have given us some of the things we can see And the last thing is say mood not to some. But you'll be here, or yeah, nipa I say, the DJ or you okay, but still be kaka and you boyfriend. Be kaka I say, well, you're quiet, or no kwa or shedem, on pair agrobium or new be ankasa. I do call friend or pay game to see a game no best 3 months. Who's about game. And some of these things are signs and symptoms of mental health challenges. Emma and Kolam.
Doc, yes, yeah, counseling kakrano. You who say you were stages of development. Na abofra behavior from infancy you know, that how like it change with time. And here's a parents, sad no, and their factor dealing with emofrana.
Yes, here okay. Because we call it age appropriate development. Okay. Say if you have a 2-year-old and I say to you, they be or screaming or shouting, what can they be? I say I am not to say what face is here, Daniel Sim. I know you're normal. Okay. But some kind of behavior in a 7 or 8-year-old should raise questions, right? Okay. So your age appropriate. In the area, Obani do best 3, still Casanencha and Baba. With me, Canada Mama, but no. Want me can't just come in and ask me pinch you. These are things we have to think about and be worried about. At the show, we did 5, still to me. These are things that we have to think about and be worried about. We have age appropriate stages of development, right? And now, Obia we did best 4. Who say sebio or display a sexual behavior kaka. And no one should to normal yet. It's too appropriate for the age. In TTC, I still be some say assembly siana or be introducing our baby for. These are questions that we ask. So in terms of age appropriate, it is either what is there is not there, or what shouldn't be there is still there.
I thought I say about for Ketuabi or ye vocal or ye too active and or ye baby above the age. The typical Ghanaian in us. Ya kwa do ya no tewa. Me be de me band or your penny near your gyness. Is it okay to leave it like that?
Well, there are different reasons for some of these things. There are some children that in Kuala because of senior adrenal developing, and they don't have patience, they cannot wait. And Bibiana, as a some way, adults are having a conversation, then they batting and they join, even though they know and the adults don't say, and yet appropriate. Ubetiano, but the next 2 minutes, those are red flags that I send you. And I say, "Cut nasty idea." To means nasty. You're complaining what school say. I call away on nasty. We did best 6 and I say 7. To means nasty. In she idea. They be around. I saw any crown still in ye. Some of these things are signs that okay, there's a challenge. We need to intervene. And yes, like ABR, how we put it, they are too known or they know too much. But sometimes I dream when I catch them say, "Jai, do it." A honor asem no what into omu some mental health interventions as well.
And you be any good near my baby so.
I know because he name it's not able any good near my baby so because we really don't know. Because you can't I call you stubborn. You'll grow out of it. In your kitty say so a lot of the time. And we trust the people we are surrounded by.
The Ghanaian in us, the religious beliefs that we have into about for a true ones. When in pass calculate now so danceable and fun to ha nor their toe and ko ha no ko ordinary Ghanaian mother or parent kai me bane won pai bom minim say radi timi ade nyina ye o radi fristro na begye me bay no tete me is it okay? Son why and we should go further.
They say baby there's nothing wrong. Prayer is a good thing. It's a support your dream because you feel say obi tie someone is helping us. it's good, it's helpful, but we can't stop there, right? I say a before for account. Oh, Kasa will be a dear near coso. I dear now, you say, now I say, oh, feel. A lot of the time, there's a lot happening in the background that we need to look at, that we need to make interventions about. And also so to meet the neighbor mental health unit. Am I share? Am I who? A dear near coso, our brother, and assist our colonel. Or you say, how can we help? Is this something you are doing? Is this something the father is doing? Is this something the child is having a problem with that we have missed? These are the little things that we can do to be helpful, and we can make interventions to help the situation.
A hyper child, me perceive if fear then later say acquire me more later then we go to a hyper child. Meaning me parent or catch him nana, me bani a hyper. Giddy. I can say can bob brandy bidi. Say bibi say secret say or say oh me snackeno. Na mama no bibia sugar wom the drinks the man kwale ya. Eni afa de aunt na se kra. Na ba mo. As a mental health doctor, what do you advise?
There's a level of hyperactivity in children and normal. You can't say interventions can carry mom because it's still to meet nothing. It's still to meet your idea. It's still to making kind maybe. It's still to meet your TV. What you say? Abofrano.
Also to meet nothing.
Also to meet nothing.
Also to meet your idea.
It's still to meet your idea.
Also to meet Didi.
It's thank you. It's still to meet Adrian about. It's still to meet nothing. Every Adrian. Sorry.
Me bed on pediane. Adrian, you'd be chasing the house. Yes.
Oh, okay. There are some children that don't like eating.
Okay.
But I mean, say, but what money in your pair? What's not? Okay. But in Kolanu Biwahwa, even if you give them what they like, they are still not able to sit down to eat. So even when they are doing things they like doing, what to me who's a hyperactivity that's all. Okay. As I say, a lot of the time it's time for us to make interventions, right? So in terms of the hyperactivity, again, your age appropriate. A 5-year-old, a 4-year-old, you'll be to me a year. And when then that's what they cannot do. Okay. Oma 5-year-old, a big book without drawing. A bit shame name say on kind eno de enfa. Inti eno de sorry. But if you give an 11-year-old that kind of book, say on kind, there should be some time that he or she should be able to sit down and read. If that is not happening, then again we need to look at it. So we have to remember age appropriate behavior. Okay. What's your say? What is the old running around? But like, bibia to me it's not to me focus. Usmana okay half, na the refi other half. And I say, what catch and say chain meba. But I know about not nya osi on chain or hoya dada na asem esi. These are the little things that create that are signs that they are challenges.
Such challenges you are. Your timelines are was see seeking redress and now
well, okay, before something bad happens. I wouldn't put it that way. Okay. By Enkai say we are bringing up people, right? And the way we are is because of how our childhood was. So in order to give the best, to enable our children to have the best quality of adult lives, the earlier the interventions, the better. Send your own shion bibi, what you say. Now it's around 15. Afina, you decide to say astronomy. They say you do over. Yeah, but no, the things we have to change are more than if you come when you are 8. Sometimes I thought that you say, oh, you change. Let's wait and see what the Lord will do. 1 year about 2 years about assembling koyo, but still we are waiting. A lot of the time we are eating away. We are taking good time of childhood development from our children. So the earlier the better. There's no set time, but once we see it, let's help.
Still on kids. Yeah, my parents be feeling say about fun is too early to start giving them a no, especially when a no linked to your mental health. How do you address it?
again, when so you better back to quality of life conversation.
Okay.
We have to do the best. We are doing the best we can for our children, and sometimes that involves making decisions we are not comfortable with. And a lot of time we have to remember that the quality of life we are giving them, are we in our fear of what the medication can do? Are we helping or we are not helping? This is where some of our biases can come in. And it's not an easy decision to make because we are hopeful that, but sometimes we have to be bold and take the steps. Because you have to remember, say, we the AIDS, additional motion than koye, Usmana, Untuminya, Debbie has rain, cost rubber, she senior SAC. And we have an ideal that we want our children to look like. Sometimes the best thing for the children is the medication. And it's always better to try and decide, say, minyebium, anye, rather than sit down and wait not knowing what you say. So sometimes the interventions, even for a short while, are very helpful. Don't have to do them for a long time, but you can just test and see, say, oh, a bois, then we see the way we go.
Is it appropriate to say, your day medication be aiding quadradisia?
It depends on we have to always remember that. Depending on what the issues are, if medications are needed, fine. But a lot of the time, for a lot of children, medication is not the first line. The last option. You never be brave to me and sound like a donaba. So we try all those things first. A lot of the time, if we do them, we can't respond. And see, also the time, I'm share them here. Edu. Nyama be brave. You to me and sound like you do edu. I'm in Colano. It's you don't need your last option, and yet the first option.
Okay. Maybe so about time be tea and come way, or challenge with the behavior, the receptive of environment and the things that penny age. I was say, oh yeah, ne academics any ade. Me narrow to Doctor Lorna Lartey. Maybe Hunewo Premier Care Hospital. How can you help me?
The first thing we can do is figure out what the problem is.
Okay.
A lot of the time, the lack of knowledge is what creates the confusion. Then try say, now we are just, or rather, it's creating stress for everybody. The first thing we can do is figure out what the problem is. Okay. Once we're able to figure out what the problem is, then we look at what are the interventions that we need to make for the child. Is it something that you as a parent can do? You didn't know that this was what the problem is, so that's where I come in. How can I help you help the child at home? What are some of the things you can do? What I say? What are some of the things that we need to let the teachers know and do in school as well? But we have to know what is going on first before we can make all these interventions. So coming in gives us a place to start from. If there's no problem too, when you come, they will be able to tell you that, oh, in your BBA, it will be well.
In your BBA, ne dear, your hospital, when you can your BBA pay, na ya dwene and tanta. Ana a doctor, penom pemasemo pese, or shemi.
Okay, that's interesting. But we have to remember that children are different, right? And everybody's child is different. Everybody's issues are different. It is my great joy to tell a patient that, oh, when he say it will resolve, right? But it doesn't mean that we don't want to take care of you. It just tells us that a problem is not that big,
okay,
right? And
or there may
be nothing. Yes,
any problem cry.
It just requires a little change here, maybe a routine. What you say, and I say maybe sometimes we are comparing to a previous child, so that's why we are worried. But we have to remember that children are individuals. So a lot of the BBR, you can even get a second opinion if you want, which is also quite great. Okay. But then again, if you fit into the first story, you can relax and be calm. BBR means that will be all right.
And you're not the phone. I'm confidently walking into the consulting room of Dr. Lorna Lartey. Do you know why? Mihiyamwa. And I'm not ashamed. Say mihiyamwa. It may work in. I thought we will end the conversation here, but we can't end it here. You're the last leg, ebebro. Mata die ene other entire. Ye ton pam wo TMC Fashion Center. Mata die se me dan ho pa de mechi a kire wo a. Eti akoma. Fankasa. Opek bebi apamtoma, kaba slit kaftan. Opek corporate wear suits, any casuals. Sporty one, in fact, a family shopping experience, if I fashion needs honor. We have it covered. Our TMC Fashion Center, Masamanabianse. Yeah, deliveries nationwide. 0244 272591 and 0240 3084 37. Ex natural mineral water in suo. Onumbia nourishing the pediano, suo ye, many pediano. Nenye nsufi eti no papa ne preko papa no a ene me ex natural mineral water me kan for ma wo pebi nom adwodwobo why me da so ho one yogo me oba nti de bia me ka cho se me yogurt wo ni nipadua no wo ni ta me hia se me yogurt eye e de bo nipadua no fi se nutrients ni bia me hia no me nya free yogurt no eti wo te se me a enum yogurt se wo no ma me keke eye afa hye otim se ewa pomodin mu faso emani padua no ene papa yemani padua no ewo mu etime no one yogo the very generators so we event and now we are sorry now we pay stable power companies no wonfo ne nto oman de ne nko aso a the very generators be hwe power nyina mo ahoden sem no say for event permanent use any nuanom omo after sales service kama bi when you be saw mo pa waye adwuma asifie na da krope woni nda boom ijatum ubi bia ko ebasa ahotoso aka ne se ye na no ye kuna duka chem se menye ensia home owner insurance policy bedofo ye bi ne beboa wo yenim de yeka ye bi ne beboa wo me say ye bi ne beboa wo motor insurance no fa kato kaso na soso kakra na ye comprehensive insurance na de obi ka se putuo nhimie ni dwo ehia edwo no ye bedi wona mo na accident krokro wa bi wonka bi hiem udru workshop on mo 15,000 20,000 shift that cost to NCA insurance on be your good pa enwuma ebo me ho bra eboa me dada omo na boa ma me ye on active me kama supporting system no ene omo emis eticon ene ye manim oye me face emam me pelu ene sisi bitini me mpabo ande na nsem ya na meto o ma first omo de ma me no mo jai nya na meto accessories no so me sack ene provided Premier Care Hospital a family health center ka CB wo Kasoa Tuba road no so hono ena ye de talk life if you bro ye ba sisia